In this video we are going to discuss some MCQ questions based on classification of nerve fibers. Okay, so I will pronounce the question and give a pause of 5 seconds, then I will answer that question, so you can also answer the question before I will answer. Okay, so the first question is that nerve fibers involved in proprioception is nerve fiber which is involved in proprioception is option number 1 is type A fiber, the option number B is type B fiber, the option number C is type C fiber, the option number D is type 4 fiber, and the option number E is J fiber. Okay, so proprioception, so answer will be type A fiber. As I have discussed in my video, type A fiber is responsible for proprioception, and A alpha, that is particularly A alpha, is responsible for proprioception. A beta for touch pressure, A gamma is motor to intrafusal fibers of muscle spindle, A delta for pain temperature. Type B fibers preganglionic autonomic, type C fiber postganglionic autonomic. Okay, next question. Joint position and vibration sense is carried by the first option A alpha fiber, B option A beta, C option A gamma, and D option is B fibers. So the answer will be again A alpha fibers. As I have said, A alpha fibers is for proprioception, and this is asked in Aiims 13. Okay, and previous question was PGI 2004. Next question, the third question is that A delta fibers are not involved in option number A fast pain, B slow pain, C fast pain, D epicritic pain. Okay, so the answer will be slow pain, because fast pain, which is also known as first pain, which is also known as epicritic pain, is carried by A delta fiber. Slow pain, which is also known as second pain, which is also known as protopathic pain, is carried by C fibers. So for first pain or fast pain or epicritic pain is carried by A delta fibers. Okay, this question is All India Aiims 13. The next MCQ question is which of the following carries fast pain? Again same type of question, so answer will be A delta fibers. Okay, no problem. Now the next question is sharp stabbing pain is transmitted by which type of fibers? Again same type of question is asked in All India, and the answer will be A delta fibers. Nerve conduction is slowest in. The next question, the fifth question, is about that is nerve conduction is slowest in. The option is your C fibers, A alpha fibers, A beta fibers, A delta fibers. Which of the following has nerve conduction slowest rate? So the answer will be C fibers, because I have told that it is only non-myelinated fibers, so the conduction speed is slowest in these fibers. Okay, now moving to the next question, that is our sixth question. Fastest conduction is for which fibers? Fastest conduction is for, okay, the option are A alpha, A beta, A gamma, C fibers. So the fastest conduction is for A alpha fibers, as we have discussed in previous video. Next question is that fastest conduction is for cold, pain, proprioception, pressure. So this question is applied type, because you have to know that proprioception is carried by your A alpha fibers. Okay, so proprioception conduction is the fastest. Okay, so the answer will be proprioception. The next question is efferent neuron for skeletal muscle is. The options are alpha motor neuron, gamma motor neuron, 1A fiber, and the last one is 1B fibers. So 1A fibers and 1B fibers are sensory fibers. Okay, efferent is your alpha motor neuron. So efferent neuron for skeletal muscle is A alpha fibers, alpha motor. Option C and D required. Option C, 1A and B are types of A alpha fibers. Okay, they are efferent, that is sensory fibers. Clear? Next question is warm sensation is carried by which sensation? Warm sensation. Okay, warm sensation is carried by. Option is A alpha fibers, A beta fibers, A gamma, and A delta fibers. So the answer will be your A delta fibers. Okay, A delta fibers, because A delta fibers along with C fibers carry your temperature sensation is carried by A delta and C fibers. Okay, warm and cold both. Moving to the next question, that is probably 10th question. Person wakes up with pain, paresthesia, tingling of the arms. He had slept with arm below the head. Which fibers are involved? Again I am repeating, it is applied question. person wakes up with pain, paresthesia, tingling of the arms. He had slept with arm below the head. Which fibers are involved? Option A, type A fibers. Option B, type B. Option C, type C. And option D, type C. And type C option, that is type C is for pain and type C is for postganglionic. So the answer will be your A fibers. Okay, answer will be A fibers. Right? Type A fibers are most susceptible to pressure. As we have discussed, type A fibers are most susceptible to pressure. Okay, and pressure on nerve can cause loss of conduction in large diameter motor touch pressure fibers, while pain sensation remains relatively intact. For A fibers, we have discussed we have discussed three things: hypoxia, pressure, and local anesthesia. For hypoxia, B was most susceptible. For pressure, A, and for local anesthesia, C. So the answer will be pressure. This is the applied question. Okay. So the next question is nociception from abdomen is transmitted by. The next question is nociception from abdomen is transmitted by A gamma, A alpha, C fibers, and B fibers. So the answer will be C fibers, because nociception of visceral pain from abdomen is carried by C fibers in the sympathetic system. Okay, C fibers also carry dull pain. Okay, slow pain that is coming from the abdomen part. Now the next question is also the burning pain is carried by which type of fibers? Burning pain is carried by which type of fibers? Option is A alpha, A delta, A beta, and C fibers. So the answer will be D, that is your C fibers. Why? Pain is transmitted by two fibers, that is A delta fibers as well as unmyelinated C fibers. Okay, clear? And the burning sensation, burning pain. Okay, the thermoreceptor also explain these two type fiber. Cold receptors are on the dendritic index of A delta fibers and C fiber, whereas warmth receptors are mainly on C fibers. Okay, warm receptors are mainly present on C fibers. So the answer will be C fibers. Now the next is your post-ganglionic sympathetic fibers are. So you can easily give it that as the post-ganglionic sympathetic fibers are C fibers. Clear? No problem in this question. Next question. The correct order of susceptibility of the different types of nerve fibers to local anesthesia. So you can easily give HPL. So local anesthesia is C, B, A. Okay, simple. So these are the questions which we have discussed. So if you like the video, so subscribe my channel and like the video and share with your friends.